In about the year 1981, I helped start the wound care center for our local hospital at that time called Scottsdale Memorial Hospital. Now it's called Honor Health. But there was a new hospital up north, and the ceremony to cut the ribbon, I was asked to do the first surgery. And Nancy Reagan cut the ribbon because her father was Thomas Davis, and he was a neurosurgeon, and she cut the ribbon, and I did the first surgery. Interestingly enough, the surgery was a diabetic neuropathy patient who had an ulceration. And this was before I learned the Dell technique. And we did not have all the chemistry figured out. We did not know a lot of things that we're talking about today. So that was kind of cutting the ribbon, part of my quest, trying to figure out all the pieces to this puzzle. But I do remember her, and she was a diabetic. I did not talk to her about diet because I really didn't think or didn't understand how important that was. And the reason I'm telling you that is because at that same year, I was asked to go to Taiwan, the capital city of Taipei, in then the Republic of China. And Dr. Luke Hsu asked me to do that. He was the Surgeon General, and they had a problem with diabetes. And I went there and on and off for several years, helped them with their clinics, looked all over the country to see if I could find some diabetics. I really didn't see that many diabetics. But interestingly enough, Dr. Hsu was a medical doctor, but he also had a PhD in pharmacology. So he was very interested in pharma and how to treat the Western way. I was kind of more interested in the Eastern philosophy of acupuncture and things like that. But I taught surgery in China and also lectured on our approach to diabetes, which is not the same as I would tell you today. So interestingly enough, they loved their banquets, and they took me to a Vietnamese restaurant, which was half French and half Vietnamese. Very good food, as I recall. And I said to them, "What's for dessert?" And they looked at me and said, "What do you mean, what's for dessert? What does that mean?" I said, something sweet, because I did not know or didn't really think about sugar as the causative agent. So they scurried around and they brought a bowl of ice and they poured coconut milk on it. That was the sweetest thing they had in their diet. Yet they had signs and symptoms of diabetic problem. And I asked Dr. Hsu, I said, "What's the Mandarin word for diabetes?" And he said, "Diabetes." And I said, "Well, no, that's a Greek word meaning to siphon out sweet water, diabetes mellitus." So language is very important. We assign words and sounds to the things we observe. And that word was being observed in the Greek. They knew that there was sweet water. You tested the urine by tasting it. Thank God we have new techniques. And if it was sweet, you had diabetes. They gave the patients lilac. And lilac is now a pharmaceutical agent in the United States. It's called metformin. So they knew how to treat it, but they really didn't have any understanding of where and how it was getting into the system. So now I'm in Taiwan in 1981, working with their scientists, building their clinics, visiting all their major cities, not seeing that many diabetics. But after a couple years, I was talking to the scientists and I was asked, "Well, what do you think is causing it?" And I said, "I really don't know, but I think it's your diet." And we were on the 11th floor in Taipei, a research center. And I brought the scientists over and I said, "Look down there, there's your fast food restaurant." The first one was 1979, the first fast food restaurant. And here we're probably 1982, 83, and they had a endemic problem with sugar, diabetes. And that's how it started. Me understanding what was in the diet. At that point, I really didn't understand fully what that was about, but I knew they never had sugar in their diet. But now they did. It was fast food restaurants. Now today I look at it, and there's been studies that show, there was one famous study, 37 countries for the last 20 years looking at cash register receipts from fast food restaurant. Let's say there's 20 items in the fast food: hamburgers, bun, ketchup, potato chips, French fries, soda, you name it. Number one item is soda. It's sugar. Which sugar? High fructose corn syrup. That is the culprit. That's what's causing this tsunami of sugar in our diet and the pandemic of sugar in our tissues, causing all these diseases from autism to Alzheimer's and everything in between. It's one disease, different locations with epigenetics. So the next period, we will talk about epigenetics and how this all forms biochemically all over the world.